Hey everyone, John here from Anatomy Bootcamp, and welcome into today's video. In this video, we're going to be talking about the basal ganglia. And the basal ganglia has proven to be kind of a confusing point for a lot of students because it's hard to kind of conceptualize the 3D representation of the basal ganglia as it sits deep within the cerebral cortex. So on the screen right here, I've listed all the structures, all the basal nuclei and other structures, which we'll be covering. So let's start off by talking a little bit what the basal ganglia are. Now the basal ganglia are made up of a number of basal nuclei, and these basal nuclei are just essentially clusters or masses of gray matter found deep within the cerebral hemispheres. And these are responsible majority for modulating our motor movements. So if we didn't have this network or circuitry where we could modulate these movements, we would go to make a movement and we would have no control over it. Our arms would be flailing, our limbs would be all over the place. So this basal ganglia network allows us to fine tune these movements so we can start and stop with a little bit more ease and poise. Now the basal nuclei are broken up into the corpus striatum, the subthalamic nucleus, and the substantia nigra. Let's take a closer look at these. So the corpus striatum is made up of two structures mainly. It's going to be made up of the caudate nucleus and the lentiform nucleus. And the lentiform nucleus is then further broken down into these three structures. So we have the putamen, the globus pallidus externus, and the globus pallidus internus. So where can we find these on a 3D model? So if we look here, this big purple structure that has this C-shaped appearance, this is going to be our caudate nucleus, and it's going to be the most lateral of the basal nuclei. Attached to the caudate nucleus on the same plane is the putamen, which is this blue structure deep within here. Found just medial to our putamen, we have our globus pallidum, which are broken up into the internus and the externus. So our externus is going to be this green guy right here, and then our internus is this one just tucked medially inside of it. So whenever you hear the term lentiform nucleus, know that it's referring to the globus pallidus, internus and externus, as well as the putamen. And you might also hear the term striatum thrown around, not corpus striatum, but just striatum or striate nucleus. And the striate nucleus or striatum is the caudate nucleus and the putamen bound together. So if we take a look, the caudate nucleus and that putamen kind of join right here. So we refer to them as the striatum when we're considering them together. And next up we have the amygdaloid nucleus or the amygdala, and that's these structures right here, these little basal nuclei. So these are more involved in the limbic system because they're responsible for emotional regulation rather than modulating our movements. And finally, it's not really shown here, but I thought I'd mention it. We have the claustrum. The claustrum would be actually lateral to our striatum, which is our caudate nucleus and our putamen. We're going to see it in some of the other sections of the brain that we're looking at. So you can see in this image right here, we have all the structures of the basal nuclei labeled. We'll start off with the head of the caudate nucleus. So this is going to be the thickest portion of our caudate nucleus, and it's found the most anteriorly. And as our caudate nucleus kind of courses posteriorly, it's going to form this region right here, and this is the body of the caudate nucleus. And that body is going to continue posteriorly as it wraps around and comes anteriorly again and forms that C shape. And this down here is going to be known as the tail of the caudate nucleus. So found attaching to the head of the caudate nucleus, we have this structure right here, that blue structure. This is going to be the putamen. And then found medial to the putamen, we have that globus pallidus externus, as you can see in here, that green structure. And then again, found medial to that, we have that globus pallidus internus, which is going to be found medial to the globus pallidus externus. And like we had already mentioned, we have our amygdala, and sitting just inferior to the amygdala is the hippocampus. And the amygdala and the hippocampus are actually found within the temporal lobes, and they follow the course of the lateral ventricles. So if you think about it, we would have the lateral ventricles coming this way and then wrapping underneath. They kind of follow the same course as the caudate nucleus. And that's why the caudate nucleus will make up the lateral boundary of the lateral ventricle, and this body of the caudate nucleus will make up the floor of the lateral ventricle. And as we come down here, the tail is said to make up the roof of the lateral ventricle as it follows that shape of the caudate nucleus. Now we're going to discuss some structures which we haven't previously mentioned. So first up, we have the fornix, and the fornix is going to be this green structure right here. And you can see it's kind of taking a similar route to the caudate nucleus, except instead of going from lateral downwards, it goes from medial and it comes downwards. And this attaches to the amygdala and is part of the hippocampus as well. And we also have the thalamus, which we mentioned in our previous video. And these are these large egg-shaped structures, as you can see right here, or these thalami or thalamic nuclei. And what do we have found right in the middle? Well, we would have that third ventricle found right here. Because remember, the two thalamic nuclei make up the walls of that third ventricle. And then if we look just below the thalamus, or sub, we have the subthalamic nucleus, which is going to be this little blue structure right here. And this subthalamic nucleus sits just at the corner of our substantia nigra, this yellow structure right here. And these are kind of found at the transition between the midbrain and the diencephalon. So you can see right here, this is the brainstem, and then we have our midbrain kind of sitting on top of that. So our subthalamic nucleus and our substantia nigra are going to be found within that midbrain region at the transition where it turns into the diencephalon, where the basal ganglia surrounding. But we're going to discuss them here as well as in future videos because of their role that they play in the basal ganglia network. So they play a role in the indirect and the direct pathways. So now that we've covered these structures, kind of looking at it from a 3D sort of arrangement, mind you, you would never be tested on it like this because seeing this in real life is just not very feasible. Professors at universities usually test their basal ganglia anatomy looking at coronal and horizontal sections. So we're going to focus the rest of the video on distinguishing these basal nuclei, looking at coronal sections versus looking at horizontal sections. So here you can see we have a coronal section of our brain, and the coronal section is just going to be splitting the brain into anterior and posterior. So this is kind of taking a page out of the book. And first up, we're going to identify our caudate nucleus. And remember that caudate nucleus starts anteriorly, where it's a little bit thicker, and then it courses posteriorly. So in this section, we're getting a sliver of the caudate nucleus as it's traveling from anterior to posterior. And you can also see the caudate nucleus and the putamen are kind of in the same plane. That's why they're sometimes referred to as the striatum together. So we'll label our putamen. And sitting medial to the putamen, we have our globus pallidus externus and our globus pallidus internus. Now you can see this empty area passing between our putamen right here and our caudate nucleus. This is actually a bundle of projection fibers, and this is known as the internal capsule. And this is carrying information from our cortex down the spinal cord and out to the rest of our bodies. We're going to talk about this in a separate video series. It's just good to know and be able to identify it in relation to our other basal nuclei. So this right here is the internal capsule. And just like the internal capsule, we also have an external capsule. And the external capsule is going to be found just lateral to our putamen right here. And it's situated between the putamen and the claustrum, which we had previously mentioned, but we haven't yet identified. So the claustrum is going to be a thin sheet of gray matter just outside of the corpus striatum, or those core basal nuclei. And then just outside of our claustrum, between the claustrum right here and the insular cortex right here, we have this sheet of white matter, which is known as the extreme capsule because it's extremely far out. So moving on, we have some other structures to identify, starting with these two little green little nubs right here. Remember we talked about how the fornix is going to come from inferior anterior, and then it's going to come medially and then wrap around, kind of following a similar route as the caudate nucleus. So these right here are going to be those fornices passing through this space right here. So this is the third ventricle right here. These are going to be our lateral ventricles. So it passes with the caudate nucleus body and tail through those lateral ventricles and down, and it's going to reach this point right here where the amygdaloid nucleus is. And it's going to be a part of our hippocampus as well. And it follows that C-shaped structure. So let's just go in and label these. Now moving on, we have these two very large structures right at the center. And you'll probably recognize these from the previous video. These are our thalami, together making up the thalamus. And remember, we have that little interthalamic adhesion connecting the two. And then below the thalamus, or sub, we have that subthalamic nuclei. And then you can see this part is actually part of the midbrain. So the substantia nigra are going to be found within the midbrain. And the subthalamic nucleus are going to be found kind of like at the corners of the substantia nigra, but they're more part of the basal ganglia network at the transition where the diencephalon reaches the midbrain. So they've been included up here. So now that we've covered all these structures looking at it on a coronal section, let's take a look at it on a horizontal section. So now that we've covered all the structures on the coronal section, let's take a look at it on a horizontal section. But first, let's distinguish how we can tell the difference between a coronal section and a horizontal section, because guaranteed you're not going to have an indicator like this telling you which way the brain is sectioned. So what I like to look for is the longitudinal fissure. So on a coronal section, we're going to have this longitudinal fissure separating our left and right hemispheres. And we also have this corpus callosum right here, that bundle of white matter, as it's going to connect those two hemispheres. Another structure that you'll see in the coronal section that you won't see in the horizontal section is this area right here. So these structures, the amygdaloid nucleus and the hippocampus, are going to be found within that temporal lobe. And when we're looking at a horizontal section, it's cut through the brain like this. So you're not going to get that inferior portion where you'll see the temporal lobe with these structures in it. So let's take a look at that now. So you can see here we have a horizontal section. We're dividing the brain into superior and inferior. And this view right here is going to be a superior view looking down. And you can already see it looks a whole lot different than the coronal section. Here's that medial longitudinal fissure right here. But now we have structures kind of getting in the way of that. So we have our left and our right hemispheres, but we no longer see the temporal lobes and those amygdaloid nucleus and the hippocampus. So now with all that said, let's get into identifying some of our basal nuclei. So we'll start off where we start off with the coronal section by labeling our caudate nucleus. For some reason, I always love to identify this first. It just makes things a little bit easier for myself. So the caudate nucleus is going to be found right here. This would be the head of the caudate nucleus, and it's found making up the lateral wall of that lateral ventricle. And remember, we talked about how the caudate nucleus will form that C shape and come around. So if the head is sectioned here, our body of the caudate nucleus is going to be sectioned back here. And you can see it's kind of making up the wall of the lateral ventricle here, but it's actually making up the floor of the lateral ventricle. So let's just throw some labels in there. And then we'll go on and identify the most lateral structure of the corpus striatum. And if you remember it, it's this blue structure right here, found most laterally. This is going to be the putamen right here. Found medial to the putamen, again, we have that globus pallidus externus, and then found medially to the globus pallidus externus, we have that globus pallidus internus. And then again, if we have our lateral ventricles right here, towards the midline, we're going to have our third ventricle right in here. And what do we know that makes up the lateral walls of our third ventricle? Well, that's going to be our thalamus, or our thalami. So our two thalami on either side of the lateral ventricle. So now we'll take a look at that white matter bundle, those projection fibers that we found between the caudate nucleus, the lentiform nucleus, and the thalamus. So this white matter bundle right here, if you remember what this is called, you know that it is the internal capsule. And you'll notice that the internal capsule has this very distinctive V shape when we're viewing it horizontally compared to when we're viewing it coronally. So now we'll move just outside the corpus striatum and identify those two other white matter bundles and that sheet of gray matter. So we talked about this being the external capsule. If this is the internal capsule, we have that external capsule just outside of the putamen, and we have the claustrum right here, that thin sheet of gray matter. And then we have that extreme capsule between the claustrum and the insular cortex, because it's extremely out there. And then finally, we're going to return to the midline and identify those two little circular type structures right here. These are those white matter bundles known as the Fornix. And you can see from a horizontal section, they actually look a lot different because they follow that distinct pattern which we talked about, how they come anteriorly and then they're going to travel posteriorly and then come down into that temporal lobe. So you can see the Fornix is like the caudate nucleus in the sense that it has that C-shaped appearance. So it's going to be caught in two different sections of our horizontal section. So it's going to be found right here as well as right here, just like the caudate nucleus was found right here and right here. So let's go in and label those. Awesome. So now that we can identify everything on a coronal section as well as a horizontal section, I'm going to show you guys a brain scan and you guys tell me what section this is taken from. So if we look at it, it's quite long in its shape. We would find first our medial longitudinal fissure. It's found anteriorly and it's found posteriorly, but here we have all these structures blocking it off. So what does that indicate that this is? That indicates that it's a horizontal section. And the more brain slices you view, the more comfortable you will be and just be able to automatically identify what you're looking at. So now that we've identified what kind of section it is, let's go in and label those structures, which we talked about in the previous slides. I'm going to zoom in a little bit to make things a little bit easier on us. You can see we have this large structure right here, and it's protruding into our lateral ventricle. So our ventricles are filled with cerebrospinal fluid, and on this type of MRI, they appear hyper intense. So they appear very bright. And this allows us to indicate where all the boundaries of our ventricles are. So protruding into the lateral wall of the lateral ventricle, remember what structure we had? We had that caudate nucleus. So you can see that caudate nucleus down there. And then we also have this large structure right here, which is going to be the most lateral aspect of our corpus striatum. If we remember what this is going to be our putamen. And then found just medial to the putamen, we have the globus pallidus, internus, and externus. Now they're a little bit difficult to see on this image, but if you know your neuroanatomy well enough, you'll be able to predict exactly where they are. And of course, just lateral to our third ventricle, which we can see right here, we have these two big guys right here. So these are going to be our thalami, or our thalamic bodies. So let's go in and color those. And remember, we had a thin sheet of gray matter just outside the putamen. So that's going to be our claustrum. It's going to be a little difficult to see just because of how thin it is, but we can see a faint little outline right around here. And just outside of our claustrum, we would have that extreme capsule. Inside or medial to our claustrum, we would have that external capsule. And we'd find our internal capsule right here between our thalamus, lentiform nucleus, and caudate nucleus. And we have one more structure I think we can identify on here, and those are going to be those fornices. So those two white matter bundles found right at the midline. And it looks like they're coming right around here. So these are going to be those fornices as they pass from anterior to posterior. And actually, on that note, we can also see the body of the caudate nucleus found right here, just along that lateral wall or floor of our lateral ventricle. So those are all the structures of the basal ganglia. I hope you found that video useful. And if you have any questions, always feel free to reach out to us. That's going to do it for this video, and I'll see you guys in the next one. Take care.